Capital Views is sponsored by Northrim Bank, Alaska Oil and Gas Association, ConocoPhillips, and Linden.
Hi, I'm Tim Bradner with Alaska Legislative Digest, and welcome to Capitol Views. And welcome today to Lori Wing-Heier, the Director of the State Division of Insurance. Thanks for joining us, Lori.
Thanks for having me, Tim. Always good to see you.
Lori, health insurance is the cost of health insurance, primary care, all those things are very important, and people paying a lot of attention this year. I recall last summer and fall, you were working on an outreach to primary care providers to see how they're doing financially. And what did you find out?
When the governor agreed to allow the repeal of the 80th percentile, and that came through, one of his directions was that the Department of Health and the Department of Commerce, the Division of Insurance, start looking at healthcare reforms, and the focus being the start on primary care and how providers are compensated. And so the focus of this whole project is accessibility and affordability across the state. So with the Department of Health and with Heather Carpenter from the Division of Insurance, we met with providers in Ketchikan, Fairbanks, Kenai, throughout the Mat-Su Borough, and also in Anchorage. And from that, we heard a lot of things of struggles they were having, recruiting and retention throughout the state, the difference of what an APRN to an RN to a doctor is paid. I mean, they were very open, and I don't think they spared telling us much of anything. So based on what we heard, we came back and we drafted a statement of work for a request for proposal. And now we're in the phase where the proposals that have closed. We are going through the proposals and grading them to select a consultant to take this the next step as to what we can do to improve accessibility, but also keep a keen eye on affordability, because money in healthcare, it can't be everything. We can't just throw money at the project. We've got to come up with solutions.
So, Lori, how soon will it take to get the study back from the consultant?
We're allowing 6 months for the initial phase. And I think that's a sufficient time. I mean, we've got some work we've already done. And so I think they've got a good statement of work to begin with. And the proposals that we've seen, a lot of them are already familiar with our market. And so I think they'll have somewhat of a heads up if they're the one that is selected.
But Lori, what do you, in your talks with folks, what are you hearing generally about what are some of the more specific problems they're dealing with? Just affordability, recruitment, wages?
We've heard, I mean, everything from homelessness throughout Anchorage and other areas, that there's no housing in Anchorage. They were extremely open with us when talking about the problems they were facing. It wasn't any one thing, but a variety of factors. They also talked to us about, in some of the smaller hospitals, that you recruit a physician, and I'm talking a specialist there, and there's just maybe not enough patients for that physician to keep his or her skills current. And so you lose them. And is there a way that we can have physicians from, let's say, Ketchikan or Petersburg, do 3 months in Providence in Anchorage, or regional in Anchorage, to refresh their skills and keep them current, but at the same time sending someone down to that community to fill the void so that they're not without a physician.
Lori, another thing we've been hearing about is the insurance companies' approval for procedures. Did you hear much about that?
And the prior authorizations?
Yeah.
Well, as you know, Tim, that was not our finest hour last year when we came out of 2024 legislative session. But I was contacted by Bruce Richard of Kenai Central Peninsula Hospital, and by Jared Cozen from the Hospital Association, Alaska Hospital and Healthcare Association. And we worked over the interim on a bill. The division provided technical support. They came to me with their ideas. We went back and forth. They were also bringing in, at some point, the State Medical Association, went back and forth. And at some point around November, the providers, the healthcare providers, asked me to send the draft to the insurers, which I did. We then had some more discussions back and forth as to what was acceptable, and the two groups agreed on the bill, with the division just providing technical support, technical comments on it. And that bill is now moving through the legislature, and the two groups have agreed that there's no amendments to it unless they both agree to the amendment. And so, that's good policy. When you can get those two groups to work together and come up to a solution that works for both sides, that's good policy. And we're extremely pleased that from where we were last year when we left Juneau to where we came back, that it's great strides were made.
Well, that's pretty remarkable, and it sometimes happens, and sometimes we can show the process really works. There's other bills, a lot of other bills pending, including another round of pharmacy benefit manager bills are in the hopper, and that's a very complicated area. But I know you're involved in that.
This
Um,
one I'm not so much this year. That's Senator Giesel's bill. And she is, in that bill, you're looking at Alaska Care and the state benefit programs. So those aren't under Title 21, but the bill is very similar to HB 226, which passed last year and did impact the division.
so as I understand, the bills this year would be more to fix up some of the things that were done last year.
That's the licensing bill.
Yeah.
When HB 226, when that was passed and we went back to do the regulations and do the actual, what we thought was licensure, we were told by our legal counsel, that we needed to get them licensed as opposed to registered. So we needed to come back and kind of fine tune what we probably should have done in House Bill 226 last year. And that bill is moving through the legislature too.
But that's good news. But Laurie, what does licensure mean compared with, well, people register, but what are the differences between those two?
The licensure in the Title 21, the division statutes, give me a lot more authority to do examinations and to do market conduct examinations, financial and market conduct. So I can go in and actually see if they're following the statute that came out at 226. With registration, it's no more than someone basically saying, hey, we're doing business in your state. And I really don't have any statutory authority over them.
Well, it will be interesting to see how that turns out. And you've got a lot on your plate this year, Laurie. A lot of healthcare bills moving, a lot of moving pieces.
We are busy. There is no doubt we are busy. We've got an omnibus bill that we're hoping to see pass. It is moving. Senator Clayman has a telehealth bill. Senator Giesel has a couple bills. There's no doubt it is a busy legislative session for us. Rep. Ruffridge has a bill. We're working over here.
Well, it's a busy time, and of course, healthcare is a very important topic. Insurance is a very important topic. Well, Laurie, thank you for joining us.
Well, thank you for having me, Tim. Have a good day.
Yeah, thank you.